Hello. Welcome to a brand new community health nursing lesson. My name is Jessie Wheatley and I'll be facilitating this lesson. Please make sure you have your notes in your notebook ready so you can follow along with this lesson. Thank you for listening to this lesson. This lesson covers health education for communities for RNs. By the end of this lesson, you should be able to discuss ways in which people learn. You should be able to identify the steps and principles that guide health education. You should be able to describe the importance of literacy, especially health literacy, in promotion and prevention of diseases and in health education. You should be able to describe factors that influence group functioning and how members of groups learn about health behaviors. You should be able to describe how nurses can work with groups to promote the health of individuals and communities, and you should be able to explain strategies that nurses can use to provide effective health education. Nurses need to be aware that health education is essential in nursing because the promotion, maintenance, and restoration of health relies on clients' understanding of healthcare topics. Nurse educators identify learning needs, they consider how people learn, and they examine educational issues. And they design and implement educational programs, and they also evaluate the effectiveness of the educational program on learning and on behavior. Nurses often use the Healthy People 2020 educational objectives as a guide in identifying community based learning needs. You need to be aware that education and learning are different. Education is the establishment and arrangement of events to facilitate learning, but really learning is where it happens. Learning is the process of gaining knowledge and expertise and results in behavior changes. So we need to not just educate our patients, we need to make sure that they're learning. I want to touch on three domains of learning that nurses need to be aware of. And the first one is cognitive domain, the other one is affective domain, and the other one is psychomotor domain. You are familiar with this terminology. You can read your notes and expand more on that, but you need to be aware that when you're designing learning for a patient, you need to make sure that it touches on those domains, as many domains as possible. So you want to make sure you reach your cognitive domain, the affective domain, and psychomotor domain. Depending on the needs of the learner, one or more of these domains may be important for the nurse educator to consider as the learning programs are developed. So you want to study your patient and you want to understand how best they learn, and you want to educate them in the manner that they're able to learn best, hitting the most effective domain for them or effective domain. So remember, three domains of learning. You want to make sure that you cover all domains. Another thing I want to talk about is 9 principles associated with community health education that I want to talk about. Okay, when you are educating somebody, you want to remember these 9 principles. Number 1, you want to gain attention. What is the nurse doing to make sure that they're gaining attention of their learner? Number 2, informing the learner of the objectives of instruction. You want to make sure that your patient understands why you're teaching them, what they're supposed to get out of the lesson, or what they're supposed to get out of the session. This is important. You need to make sure you cover that thoroughly and it's very well understood. Number 3, stimulating recall of prior learning. You want to make sure that you actually are visiting with that patient and you're asking them, what do you know about this subject? What do you remember from the last educational session? You want to stimulate recall of prior learning. Number 4, you want to presenting with stimulus. When you're presenting information, think of ways you can stimulate the patient to understand it better. Think of things you can bring to educational session to make sure that the learning is interesting. Number 5, providing learning guidance. You want to make sure that you're guiding through the learning. You're not just kind of letting people learn on their own. You want to guide them. Number 6, eliciting performance. So you have taught them how to do something. What can you do to elicit them showing you how they're doing that, or showing you that they're actually adopting what you're teaching? Number 7, you want to provide feedback. So after they've shown you what they're doing, you want to say, okay, this is how I think. Make sure that feedback is positive. If there's areas of improvement, you want to point them out as well, but you don't want to point them out in a manner that the patient feels discouraged. So what you may do is tell them, I see that you have understood really, really well on this, and I want to make sure that you continue doing this. But this is something that you can also add to that to make sure that what you're doing keeps getting better. Okay, number 8, and assessing performance. You want to assess the performance and make sure that they're able to adopt whatever you're teaching, and enhancing retention and transfer of knowledge. Okay, there's going to be things you can do to enhance retention and transfer of knowledge. Think of things that you can do to make sure that that patient really gets what it is you're learning. These are important. 3 domains of learning. You want to hit all 3 domains. 9 principles of community health education. You want to remember those. Community health nurses are not just using guesswork to teach communities, they're also aware of the educational issues that affect populations and learning. So let's talk about this a little bit. Some of this may be review, some of this may be new. You need to know that theory can guide the development of health educational programs. I've included 2 useful theories that you can actually look at that are discussed. Feel free to look these up in your spare time. And principles that guide the affective educator includes message, the format, the environment, the experience and participation and evaluation of that message. You have learned these concepts before in your teaching and learning part of your educational program. You might want to visit that if you do not remember. Educational issues that include population and considerations. You need to remember barriers to learning. What are things that may hinder a patient from learning? You want to also include technological issues. Okay, 2 important learner related barriers that I can think of that are good examples. Think about low literacy levels. You want to make sure that you're paying attention to the literacy levels of your patients. And not only literacy level, there are people that are educated, but they also have a low health literacy level. So you want to make sure that you adapt to that. Lack of motivation is another factor that you might also include, that also it can be a barrier to learning. What kind of process goes into effect when a nurse decides to educate people? I'm going to talk about 5 phases of the educational process. The first phase should be identifying the educational needs. You need to look at your patient population and look at the needs that they have as far as what health educational needs they have. Number 2, you're going to establish educational goals and objectives. You're going to look at your lesson and what you're trying to accomplish, and you're going to make goals and objectives. Then you want to select the appropriate educational methods. You need to think about your learner and how they learn and barriers to learning, and pick the right methods of educating them. You want to implement the educational plan. This is when you actually go out and actually do the education, and you want to evaluate the educational process in the product to see if it worked and what you can do differently. These are important things to do when you're actually involved in educating patients. Evaluation of the product includes the measurement of the short and long-term goals and objectives related to improving health and promoting behavior changes. I've heard a lot of people talk that they say that they have tried to educate a patient and the patient was not receptive and then they gave up. That is not what we do. We're going to educate the patient. We're going to go through the 5 phases of the educational process, and we're going to evaluate. We may need to plan another educational session, and we may need to plan it differently, looking at how well the person learns and incorporating that in our educational methods. We're going to summarize education here by talking about educating groups. I want you to know that educating groups is a little bit different than educating individuals. Since this is a public health nursing course, it's important that I point out a few things about educating groups that I think you need to be aware of. It is important skill for nurses to be able to know how to educate a group. Groups are an effective and powerful vehicle for initiating and implementing healthful changes and promoting health. A group is a collection of interacting individuals with a common purpose. So they may be gathered for different reasons. Right now, you guys are a group of nursing students. So in that group, you have a common purpose is to get your nursing education. Each member influences and is influenced by other group members to varying degrees. It's important for the nurse to be aware of this influence and be aware of the varying degree that the group influences each other. Things that are important to remember are group cohesion is enhanced by commonly shared characteristics among members, and it is diminished by differences among members. So as a nurse working with groups, you need to make sure that you pay attention to group cohesion. You want to make sure that you're putting more emphasis on things that are shared as shared characteristics, and you want to make sure that things that are not shared are diminishing to make sure that you have group cohesion. Cohesion is the measure of attraction between group members and the group. Cohesion or a lack of it affects the group's function, and it may also affect your teaching. Other things I want you to know about groups. Norms. Norms are standards that guide and regulate individuals and communities. When you're studying a group and you're reaching out to a group, you want to make sure you're paying attention to their norms. These norms are unwritten and often unspoken and serve to ensure a group movement to a goal, to maintain the group, and to influence group members and perceptions and interpretations of reality. I'm going to give you an example. You guys, as a group of nursing students, if my goal today was to teach you how to smoke and I brought some cigarettes to class, that would be something that nurses don't typically teach each other or do in a group. So that would be against the group norms. We don't have a written rule that nurses are not going to gather and smoke together. We just know that it is just an unwritten and unspoken rule. So when you are teaching groups, you need to be aware of the group norms. Some diversity of members' backgrounds is usually a positive influence on groups, so you don't want to go ahead and just not like the diversity in the group. Groups may be diverse as far as individuality goes, but you need to be aware of the norms. Groups go through a set of stages in order to form and operate and adjourn. So you also need to know what stage the group is in. You can imagine a group of freshman students is going to be different and very well have a different group cohesion as a group of senior level students that have gone through nursing school together and are about to graduate. I'm sure you can relate to that. Leadership is an important complex in a group concept. You want to identify what the leadership rules are in a group. You want to know who are the ones that make the rules. Leadership is described in different terminology. It may be a democratic group. It may be a paternal or patriarchal group. It's important for you to pay attention to group leadership as you plan your teaching. Okay, group structure emerges from various member influences. So influence including members' understanding and support, and some people have a formal structure as far as who is who and what they do. It's going to be important for the nurse to understand all of that. Okay, conflicts will come and arise in a group. Conflicts in groups may develop from competition for roles or member disagreement about roles ascribed to them. So health behavior is greatly influenced by the group to which people belong and for which they value membership. A lot of community and public health outreach programs are going to involve nurses working with groups. You have to have an understanding of the group concepts, a basis for identifying community groups and their goals and characteristics in their norms. Nurses use their understanding of group principles to work with community groups towards a needed health changes. Nurses are also involved a lot in forming support groups for health outcomes. Thank you for listening to this presentation. I hope you have enjoyed listening to this overview of health education for communities and concepts that an RN needs to remember. For questions about this lesson or corresponding notes, please feel free to email me. Have a lovely day.